Dayton Children's provides the specialized care for the smallest, most fragile infants that are born in our region. We also provide the right care for kids affected by severe illnesses and children born with congenital problems and may require a lifetime of specialized care. We also treat severely injured children from outlying areas who are flown into our trauma center.
When we got to the emergency room, they took us right into a private room and started working on Benjamin, doing tests on him to figure out what the problems might be. Everybody in there was confident in what they were doing, and that made me more confident. All the staff at Children's is very passionate. Rarely did people leave right when their shift was up.
There's nothing worse than to have your baby or your teenager come into the hospital and you be there wondering what's going on. So we include all of the family and the way in which we deliver care. Teamwork is critical for the delivery of care for our children. Together with each of the team members, we are able to customize the care specifically for your child.
Sometimes when children get sick, there's multiple organ systems that are affected, and it takes a specialist to treat those organ systems.
There's a real shortage of pediatric specialists nationwide, and we're very lucky to have a very full staff of pediatric specialists here at Dayton Children's. Pediatric surgeons are trained in general surgery first, and then we do at least 2 more years of pediatric surgery. It's particularly rewarding to be able to fix a problem with a couple hours of surgery, in the first day that they're born, and then see them back when they're 2 years old, 5 years old, even 10 years old, doing well from that problem.
The newly renovated emergency department and trauma center is uniquely designed for the physicians and nurses to respond quickly. Our mobile intensive care units are specifically designed to be able to provide the highest quality of care for the most critically ill child. Our transport team can arrive on the scene, have all the equipment they need to be able to provide stabilization.
When Amelia was 2 days old and we were still in the hospital where I delivered, we found that she had a rapid heart rate.
These 3 people who showed up who were clearly professionals with this box with all of these tubes and such coming out of it, and to watch our child be loaded into that was rather frightening, but at the same time they were explaining that it was like a hospital within this small contained area.
It's important to understand that children are not just little adults. And so the care that is rendered to a child is unique to that child.
Children with cancer have a chronic illness that requires intensive therapy in the beginning. Chemotherapy can be very hard on the family, so when we finish chemotherapy for a child, we like to celebrate. We will do this with songs, we give them a gift. We've even been known to spray them with silly strings. It's exciting for the staff as well as me to see the kids go through this, because we know that they're into therapy and we know they're going to do well from there on out.
When we first heard that Allie had cancer, I don't think there was anything harder I've ever heard, but knowing that her treatment, almost 3 years, all the procedures, everything she was going to have done would be able to be done right here in Dayton, Ohio, was such a relief.
We got to know everyone through the hospital. It became a second home for us.
It's really amazing how much is here and how good it is. And this hospital is actually rated, and we didn't know this until after the fact, among the top 10 in the country in many specialties. It's just nice to know that you've got something like this right in our own backyard here in Dayton.
Right care.
Right now.
Right here.
Dayton Children's.
Just right for kids.